patient identified as a presumptive positive for the COVID-19 coronavirus.
1 year ago today, the first coronavirus case in Texas was reported right here in the Houston area. An elderly man in Fort Bend County was infected. He, of course, was the first of many, with Houston's 19-county region reporting more than 580,000 cases over the past year and more than 5,800 deaths as well.
Fast forward 365 days later, after the run on groceries, the masks, the shutdowns, and the loss of life. Houston is the first city in America to have confirmed cases of every single major COVID variant. The vaccines are here. The end is in sight, but the pandemic is not over just yet. We have learned so much in the past year about the virus, the best prevention methods, and how to treat patients with COVID.
So tonight we return to where it all started right here in our state, down in Fort Bend County. KPRC 2's Keith Garvin is live at a medical facility that has been fighting this virus since day one. Keith?
That's right, Chris Dominique. It's hard to believe it's been a year since that first confirmed case of COVID-19 here in Fort Bend County. We're outside Oak Bend Medical Center, one of the many facilities and systems across the area fighting on the front lines.
We know this news is concerning. It is not unexpected.
1 year ago tonight, we reported the first confirmed case of COVID-19 in Fort Bend County. Not only the first in the Houston area, but the entire state of Texas. The patient was a man in his 70s who survived after contracting the virus on a cruise ship in Egypt.
At the time, we didn't know how deadly it would be.
Joe Freudenberger is the CEO of Oak Bend Medical Center in Richmond in Fort Bend County. Freudenberger says there were so many unknowns a year ago, complicated by rapidly changing guidelines and even politics.
You have this potential for harm to family, friends, and self, on top of uncertainty as to what the true path is that we should take.
The disease continues to have negative ancillary effects as people with other chronic conditions are not seeking treatment out of fear of contracting COVID.
COVID has hampered our ability to manage the overall health of our community, and we're going to see that manifest itself out over the course of 2021, if not beyond.
He likens his staff and other medical professionals to warriors.
Watching these folks labor on the front lines, it is a war they've been fighting, and it is remarkable what they've done to preserve life.
And Freudenberger says one of the positives that he's been able to take from this pandemic is that it has bonded his staff. As a matter of fact, he says turnover decreased dramatically last year, and he gives that credit to a team effort and also a team effort under stress. Reporting from Richmond, Keith Garvin, KPRC 2 News.